4:46 in the afternoon. We turn to 5 on your health. And I don't know, hot days, warm nights. I mean, we're in the middle of bam, we get hit like that. And experts say both can be bad for your health. As you can see, joining us right now is Dr. Todd Ellerin from South Australia. It's great to see you again.
Good to see you, Eddie.
And so we are going to talk about heat. But you were with us yesterday, and we were talking about the Ebola outbreak in Congo and Uganda, and we just got new numbers in today. So in 24 hours, and it's moving fast. 131 dead, over 500 suspected cases. What is it going to take to get? I'm going to ask you a weird question. To get the situation under control, can you get it under control, and what's it going to take?
The Ebola outbreak is not just a viral crisis. It's a tragedy of isolation, of military conflict, and of displacement. But here are some of the things we can do to get it, under control, okay? Rapid case identification, all right? Contact tracing is key. Trust building. We have to dispel misinformation, disinformation. Adequate PPE.
PPE being? Personal protective
equipment, exactly. Treatment centers are key, even though we don't have specific treatments or vaccines, right? Intensive care and safe burial practices, because you can spread Ebola even after someone's deceased.
Which is a point you brought out yesterday, which I never thought of, but it's a key point. All right. Let's talk about the other big medical story that's affecting everyone. It's the heat, and it's not just during the day, but it was overnight. We went home from the news last night, Dr. T. Honestly, it was like 73 degrees. It was like stifling out there already. So what's the problem? How can we deal with this?
So Sarah, one of our executive producers, has always emphasized to me, we focus on the top number of what it's going to be during the day, but the bottom number, the coolest temperature, is rising over time, so you don't get a chance to cool off. And when you're so hot at night, what happens is your sleep gets disrupted, and when your sleep gets disrupted, your immune system doesn't function as well. Your chronic diseases like asthma, heart disease, diabetes don't like the heat, so it's a real problem. So if you do have an air conditioner, it's really key at this moment.
And it's not even summer. It's not even Memorial Day yet. It's close, but it's not Memorial Day yet, and so it's not summer officially. And we're still waiting for the first heat wave. And this won't be a heat wave. Is there anything the family should do now to prepare?
Well, it's really important. Hydration throughout the day is critical. Right. Staying indoors, especially at those peak hours between 10 or 11 and 3 p.m. You really want to be indoors. If you don't have an air conditioner, if you can buy a unit, a window unit, that can be key. The other thing is have a plan. Speak to your primary care provider and have a medication plan. Make sure you know where to store your medications. Make sure you have excess on hand, because again, these chronic conditions worsen during heat waves.
Good points, Dr. T. Thanks.
Good to see you.
Stay cool.
You too.